We're going to depart a little bit from the pelvic floor strengthening for a little bit, and we're going to talk more about pelvic floor muscle relaxing, breathing, and stretching. The strengthening is absolutely a vital component, but equally as vital is knowing how to relax those muscles, knowing how to breathe properly, and stretching. If your muscles in your legs are tight, if you're breathing incorrectly, that can lead to pelvic floor dysfunction down the road. So first we're going to talk about diaphragmatic breathing, and I just want to point out that I have this bolster under Rachel's knees. At home, if you have a wedge or pillows or something to put under your knees, if it's comfortable, that is wonderful for getting those pelvic floor muscles and also your abdominal muscles to just be a little softer and more relaxed. And for most people, having something under their knees does help with any back discomfort when they're lying on their backs. So with diaphragmatic breathing, what I want you to think about is when you inhale, your belly, your ribs, and your back should be expanding. It's a 360-degree expansion. Sometimes what happens, especially if people have chronic pain or chronic conditions, they have a tendency to breathe from their chest. It's very shallow. Shallow breathing can lead to pelvic floor dysfunction because, like we talked about in the beginning with the canister pressures, there's that relationship between the pelvic floor muscles and the diaphragm. So if the diaphragm's not getting its full expansion, it can have an effect on the pelvic floor. So Rachel, what I want you to do is I'm going to have you put one hand on your belly and I'm going to have you put one hand on your chest. And when you inhale, I want you to think about your belly and ribs lifting before your chest, okay? Again, just like with the other breathing, it's slow, it's controlled. Inhale, good expansion. Slow and controlled exhale. Good. Let's just do 3 or 4 of those. Go ahead and breathe in. Big belly. Slow and controlled exhale. Good. Let's do 2 more. Excellent. And last one. Big belly expansion. Slow and controlled exhale. At home, after you've done your strengthening exercises, this is a great way to end your session, just lying on your back and doing 7 or 8 reps of diaphragmatic breathing.